Call our meeting to order. I just can't until on the computer brings up the, I just have one of them. They're different. Okay, I'm gonna go ahead and call us to order. We are at quorum. Welcome, everybody. Happy end of August and very rapid descent into fall. If anyone has noticed. Okay. Okay, we're gonna start with privilege of the floor. And I think we have two folks joining us for privilege of the floor. So Michael, perhaps we'll start with you.
Great, thank you. I'm going to be very quick. I've appeared in front of the board many times on behalf of Asteri. I'm reaching out today, or I'm talking today specifically about the stipulation in front of the Tompkins County Board of Health regarding the waste management plan. On behalf of the organization, there are two things I would like to say. One, we are working as best we can to resolve the pest management issue. We have been communicating with and trying to work with Orkin. We provided a pest management plan to the Department of Health to review. I believe that's still under consideration at this time, but I do know that they are aware of the steps that we are taking with regard to that. The second is in regards to the waste management plan. And I want to make it very clear that, they are taking seriously this issue. I met with the waste management people this past Friday after being invited by Vecino to do so. And I communicated with them. It's my understanding they are going to provide an updated plan. And as of when we met on Friday, they were working to do that. So that is something that is being addressed by the organization. I'm sorry that I've had to come in front of the board so many times to talk about these things. But I do know that this organization is committed to trying to make things work and committed to trying to make things better. And we appreciate the Board of Health and the opportunity to speak in front of the Board of Health. It's my hope that you will hold off on any type of fine and allow for maybe some type of graduated fine, different things like that. And I realize asking that, I've done that multiple times. So that is not lost on me and me having to do that. But it is my hope that you will consider that. And again, we appreciate the time that you are allowing us to speak, and we appreciate the individuals that work at the Board of Health and that I've communicated with. I've had good relationships with Mr. Shea and Mr. Parr. They're a joy to work with. So thank you very much. I appreciate it.
Thank you, Michael. Okay, and now we'll switch to Iman. Am I saying your name correctly? Iman?
It's spelled an I, but it's pronounced amen. So
Amen. Okay, thank you for the correction. I appreciate it. So 3 minutes for addressing the Board of Health.
all right. First, I'll be doing my client a disservice if I didn't at least address some legal arguments. I think the time to make those legal arguments have passed. I should have, someone should have appeared before the hearing officer. But just from a legal perspective, I'm not sure that 1399C applies here, only because there's a carve out under the law that says tobacco businesses are, the law doesn't apply to a tobacco business, nor does the law apply to a business which requires the admission of the person to be 21 to make a purchase. So I'm not necessarily sure 1399C applies here. And even when you look at 1399MM, that also requires that the product be on a display shelf directly accessible to the public. And unless I'm mistaken, I don't believe that the public ever had access to any of the vape products that were sold at the store. They were behind the counter or in the back room. Now, having said that, that's not the main purpose of me appearing before you today. I reviewed the recommendation, and one of the things that was noted in there is that at the very, very last, it says that it's unlikely that this vendor of tobacco and vape products will operate in the future in compliance with New York State public health law. I provided to the board, granted it was about a half hour ago, but I provided to the board a copy of my client's final sales tax return. My client is not a New York State resident. He's never stepped foot in Ithaca. He's been in New York, but never in Ithaca. He lives outside of the state and he owns tobacco shops outside of the state. Unbeknownst to him, flavored vapes weren't permitted in New York. He had no idea about that. He contacted me. He then immediately closed down the business. You can see that his last day of business was April 20th. He closed down the business. He sold his lease rights to somebody else. He's no longer operating in Ithaca. He took a significant loss on this business because he did do all of the build out work, and his product also was removed from the business. So we're just asking that you take that into consideration. When you say that there's no guarantee he's going to be in compliance, he is in compliance. He's not there anymore. Now, I don't know if there's another smoke shop that moved into that location. I'm not really sure. All I know is that my client's not there anymore. And, to the extent that, and again, the hearing officer already hit on this, but, the inventory, the amount of inventory recognized the extent of the harm if all of the inventory were sold into the community, which is not the case here. I would say a majority of the inventory was confiscated and or removed from the premises after I met with my client and explained to him that flavored vapes were not permitted in New York. There's a little bit of a confusion because the vendors can sell them to the businesses, but the businesses can't sell them to customers in person. You can only sell them online. That's a whole nother fight with Albany, I guess, not necessarily with you guys, but just asking you to take into consideration the fact that my client closed the business down. You have proof of that before you, and just asking if there was something that could be done to reduce the recommendation of the hearing officer, because that is a significant fine for my client for something he was unaware of.
Great. Thank you so much for your comments. We appreciate it. Thank you to both of you. And we'll take those into consideration when we move to the enforcement action portion of the agenda. So now I'm going to move on to the approval of the minutes from July. So looking for motion to approve as written. First from Samara and a second from Melissa. Any discussion on those items? Edits? Okay, all in favor? And that's unanimous. All right, let's move on to the enforcement actions now. So our first enforcement action is related to Ithaca Tobacco and Vape. So why don't we start with a motion to approve the enforcement action as written. First from Melissa. I have a second from Frank. Okay, Skip, anything you would like to share with us about this before we start to discuss?
Sure. So as you'll see in the packet, the hearing officer recommended a penalty of $27,050. We maintain the maximum penalty as per the health policy. And I guess I'll just comment on the quarterly sales tax return that we received. So on here, it says last day of business was April 20th. If you look at the last time we were there was May 1st. And at that time, we observed a certificate of sales tax. And it was the same Ithaca Tobacco and Vape LLC, and it was just renewed. So that's kind of the thing that we wrestle with all these tobacco shops is when it's an LLC, it's very difficult for us to discern who the actual owner operator is. But there was a certificate at the location for Ithaca Tobacco and Vape LLC on May 1st.
Okay, so can I just paraphrase back to you what I think you're saying is that even though this documentation says that the business was closed, when you showed up in May to do your inspection, there was a certificate in the store posted somewhere that says they're still doing business as this entity. So how is it possible that so did they close it and then reopened it under the same name?
We don't know.
Okay. Okay, and any other questions on that one from board members?
I guess I just want to make a comment too. I feel very strongly that if you're going to sell something in a state, you should know the local rules. So That's all.
And then I guess I had a question to Skip about the comments of, um, during the comments that were just made
Yeah.
about the inapplicability of 1399C or inapplicability of 1399M or N, which I think was part of the argument. And whether you had thoughts on that. I think they said C. I'm sorry if I wrote it down wrong. Yeah, so statement of violations, section 1399CC. And then 1399M and N. I mean, I guess the hearing officer did not dispute that those were appropriate. Dispute that those were appropriate citations or violations relative to those sections of the statute.
Yeah, in terms of CC,
Okay.
Public Health Law 1399 CC prohibits the sale of tobacco products, e-cigarettes, liquid nicotine, smoking paraphernalia to individuals under 21,
Okay.
and establishes compliance requirements. In terms of MM, that's where it talks about the flavored products being prohibited with nicotine.
Okay. Welcome. Thank you for being here. We are on the first enforcement action against. Okay, any other questions or comments, discussion from board members? Ready to vote? Okay, all in favor is written. All opposed? And abstentions. I abstain. Okay. Have the whole discussion. Okay, great. Okay, so let's go to our next enforcement action. Okay, next enforcement action is going to be another Achieva one. This one is related to escape. And so if we could have a motion to approve of it as written. I have a first from Ed. Second. A second from Andrea. Excuse me. Okay, Skip, on this one, we did not have any privilege of the floor on this one, but are there any other comments related to this that you wanted to share?
Yeah, so this is an interesting facility because when we were there, we're not aware that they even have a certificate from taxation and finance. So we did include that in the orders to provide one. But as far as we know at this point, they currently do not even have a license from Department of Taxation and Finance. Again, the hearing officer recommended a lower penalty of 25,000 compared with our recommended penalty of 90,000. And because they don't have a registration from tobacco and finance, we really can't make a recommendation for suspension or revocation at this point. So we will continue to, try to communicate with DTF to see what they're doing on their end, since they have, a facility selling product that's very much taxable, to see if they're going to make any effort on their end to take enforcement as well.
Yes.
Have there be a move to prevent them from getting a license because of this?
I don't know. That's a good question. Based on our interactions with the state with prior enforcements, I don't think that we would have any standing in that regard. And technically, we don't even have to inspect facilities that don't have a taxation and finance license, which personally, I feel like that's a disservice to the community if we're doing that. So we, continue to look at those spaces.
Questions or comments? Ready to vote? Okay, all in favor as written? And we're unanimous. Okay, we're switching, we're still in enforcement actions, but we're going to switch our focus to food service violations next. So the first one is going to be Ninja Chicken, to just make sure everyone's on the correct enforcement action. So let's start with a motion to approve the action as written. I have a first from Samara, second Ed. Anything additional on this one that you need to add aside from what's already here?
No, I think it's pretty straightforward.
Okay, any questions or comments from board members? That's it. Just want to make sure. All right, let's go ahead and vote. All in favor is written. And we're unanimous. Let's move to the next enforcement action, which still, if I remember correctly, is food service related. This one should be PDR's catering. So let's begin with a motion to approve as written. I have a first from Dr. DeLima. Second from Samara. Again, Skip, anything you'd like to add, start the discussion, kick off the discussion with your.
I'll just mention this was a temp food operation that operated at the festival. It was hot movie violations.
Is this Ithaca Festival or Grassroots? I thought.
Yeah, it's bigger.
Oh, right. It was previously a Grassroots, right? Okay, sorry.
Got it.
I had Grassroots in my head. Frank,
It was initially at Grassroots where they were,
there was no.
no
critical.
critical
Yeah.
violence.
And then Ithaca Festival, and then they went to Grassroots, and then back to Ithaca Festival, and then a re-inspection. Okay, sorry.
So these mobile operations, Tompkins County inspected them, but they are housed in different counties. It don't matter. Does that county's health department become involved?
Typically, no, not in terms of enforcement. Sometimes we'll notify them if the commissary is like in a different county. We've been notified of, mobile or temp food operations. They have a commissary here where they had some significant violations, but action would be taken where the violations occurred.
Thank you.
Any other questions? Ready to vote? Okay, all in favor? That's unanimous. Let's move on to the third one, which is related to Lotus, just to get yourself on the correct page. So let's begin. Lotus, yes, Lotus. So if we can begin, this is actually more equipment related than that's a monitor one. Okay, so if we could start with a motion to approve as written. Got a first from Ed, a second from Frank. Skip, is there anything you want to add to this?
Just that it's a violation of Board of Health orders. They were here back in March. Same violation.
Yeah.
Nothing. No access to.
Okay, any questions, comments on this one?
So,
Yeah, please.
so, was a fine levied last time?
Yeah, that's outstanding still.
So the fine here is separate, it's not added on to. what was
Correct.
paid?
It should be in two different lines. The outstanding penalty of $400 and then the $800 is the new penalty. So should be a total of $1,200.
Okay. Thank you.
Questions?
Oh, so what happens? Is it? Fine, so you're out?
If they don't pay.
Well, if reinspection is the same issue, we just keep on levying fines.
I mean, we have other tools in the toolbox. Could require them to take a serve save course to understand why it's important to have a thermometer to check temperatures. We could, in the past, had facilities maintain a temperature log, so they're actually writing down the temperatures of the food that they're cooking. So if this doesn't work, then we would find another tool in our toolkit.
Favor is written. Unanimous? Okay, now we're going to switch gears again. And our last two are the exterior related violations. There's two separate orders here. So the first one we'll start with is the nuisances and sanitation. Well, first one is the nuisances, I think, which is the cockroaches. So let's go ahead and put this under a motion to approve as written. First from Frank. Second from Melissa. Okay. Is there anything you'd like to, how you want to lead this off?
Yeah, so we're not seeking a penalty for this particular draft resolution. Asteri, they do have a contract with working for pest management. We did work with Cornell Integrated Pest Management to kind of get some more expertise around this issue, determined that more needed to be done in that area. They have since submitted a plan, as Michael suggested. We did respond back to accepting the plan with some conditions. We had their plan reviewed by Cornell Integrated Pest Management and incorporated some of their recommendations into the plan. And I will say that this is a long-term plan. It's not something that's going to happen overnight. They have it broken down into different sections. So short-term is the first 6 months, midterm 7 to 12 months, and then 12 months and beyond in terms of ensuring that they're controlling the pest management at the facility.
Yes, Frank.
Does the plan include just general public spaces or
No.
individual apartments?
No, a big part of the plan is individual. There's apartments that, I don't know if they have access now, but prior they were saying they did not have access to these apartments to get in there to treat or clean up. So it does address those, what we are considering to be problem areas. So there's a separate quote that Orkin provided to actually go in and do the cleanup in, I don't remember how many apartments. And after they do the cleanup, they're gonna start treating.
Cleanup, meaning dispose of refuse? as well?
Yeah,
But if, so, say there's a problem apartment,
Mhm.
they clean up, they breed. The cockroaches go just next door.
Mhm.
So we've got continuing problems down the line on the floor or.
yeah, it's very comprehensive. It will, they are treating the entire building in addition to individual apartments as well. They've also added, they called it a lease addendum. It kind of establishes that tenants have to let them come in to treat the apartments to keep things under control. So we felt it was pretty comprehensive plan. Hopefully it'll be successful as long as it continues to be implemented.
That's good. It's a step in the right direction. That's what
Yeah.
I would be saying, which is that it appears that they are not just addressing something in the short term, but are actually have a plan to manage this in the.
Yeah. Yeah, because it needs to be sustained,
Yeah.
basically
Yeah.
ongoing.
Well, and it also sounds like it's not just about the treatment, the pest treatment, which is one component of it. It's also about tenant behavior, right? And what's bringing cockroaches in the first place.
Yeah, yeah. And they're also, looking at exclusions. So if there's, holes around plumbing entrances, if they're, caulking around that, that was in the plan as well.
And so what this order, this is not a, like you said, it's a fine. It's basically an order that's including the commitment to the long-term sustainability and the ability to apply fines should they not continue to, okay.
Yeah, exactly. And we're asking, we haven't received any reports or receipts from Oregon yet, but I'm assuming if this gets adopted, that they will start, we asked them to submit reports and receipts, 3 days after the treatment, just so we can keep an eye on things are moving in the right direction.
Okay, great, right.
So are you and your staff will have the responsibility for reviewing the steps along the plan, to make sure that they're executed? Is that a scary?
Yeah, I guess it depends. We're there doing inspections as part of the trash management. So if we're continuing to have to be out there, obviously it'll be something that we'll keep an eye on. I suspect a lot of it will be complaint driven because the impact has affected neighboring properties. So the hope is that we'll see those complaints continue to go down. So, yeah, I think this gives us the authority to make sure that they are staying on top of it. And if not, then we can bring it back to the board and make adjustments.
All in favor as written? Okay, so let's go to the second resolution related to Asuri. This one is a bit different than the one we just did. This one's related to the sanitation and trash. So just to make sure you have the right one in front of you. It should be, it's enforcement action 2026-33. Three.
Oh, yeah. Agree.
Yeah, 3. So if you go to the second page, you should see that it's related to trash.
2.
It's dated August 17th.
2, 3 is the older one. Is that right?
Yeah, there's another, the 2, 3 is
Yeah.
the one we just did, which was cockroaches. 3 is the next one. Just make sure you can get to the right place. Okay, so a motion to approve is written. Comes from Ed. And second from Dr. Dornbach. Okay, Skip, anything additional on this one in terms of discussion for us to be aware of?
So there were violations of Board of Health orders. The chute doors were supposed to be corrected by July 24th. We were supposed to get a waste management plan that was revised by July 24th. And then the other order that we cited was, to maintain compliance with section 1300 of New York State Public Health Law. We had been doing fairly routine inspections. So we did an inspection on June 26th, which was shortly after the first Board of Health orders were adopted. And then on July 27th and August 10th. So probably, I think the best way to understand it in terms of the the penalty is to look at the proposed, payment methodology, which looks like this.
Which is numbers.
It's listed as page 10.
No, that's 32.
So I think it's page 59 of 95 in the packet.
Okay, can you just read it so we make sure we're looking at the same thing?
Yeah, so it says proposed penalty methodology for draft resolution ENF 2026-33. And it has
Is it
three
attached?
tables.
Oh, that table. Okay, I'm not down far enough. I got it. Okay, now I'm there.
Just to kind of make sure I have this accurate, the penalties are a penalty per day, right? That it's not done.
Yeah, per violation.
Per violation per day.
Yeah, and we broke it down. So the reason why we thought it'd be more digestible. So if you look at table 1, so those are based on the inspections that we did, and we broke it out by the 2 articles of the sanitary code. So Article 4 is related to refuse, and Article 5 is the nuisance. So for each inspection day that we did, we broke it down by Article 4 and Article 5 violations. So
The first 3 columns are Article 4 violations.
right, so that would be when we observe like trash overflowing in the trash rooms, or, the refuse and trash related violations, where Article 5 violations are if we observe like feces, blood, etc. in the stairwells, but we also identified the open doors as a nuisance for the odors. So on every floor, and there's a trash room, and you can see in the pictures. And so we counted up the number of open doors on each day of violations to get our, total number of violations. So that's table 1. And then, so for table 2, we did it based on the number of days that they were out of compliance with the Board of Health order. So for example, the repair of the chute doors, that was supposed to be done by July 24th. So the 17 days is July 25th. I think we counted through August 10th to get to 17. So, and then for section 1300 of New York Public Health Law, we did that just generically based on the number of inspections that we did. So that's how we came up with the total number of violations. And I think the other thing to point out in our calculation of this is we didn't recommend the full $2,000 violation per day, but we wanted to kind of keep that open for the board to consider. So if you feel like it needs to go, for the full 2,000 per violation, then that's your prerogative to do that. So I just wanted to point that out as well.
But these totals are not that.
No, these are based on $1,000.
Yeah. Just want to make sure I understood that. Thank you.
Table 1, floor 1 had violation. Which is
Yeah, that would.
conference center.
That's
separate from it.
It wasn't in the conference center, it was in the stairwell.
And Skip, they still haven't paid the $9,000. When was the $9,000 originally due? what said the remaining
I
9,000?
think it was August 15th was the due date.
Okay, and we were going to waive that if they did 2 through 7, but they didn't do 2 through 7, so that's why it's in there, right?
Correct. And we did send out a notice to them
Oh, good.
that they owe that penalty.
Okay.
Failure to meet the requirements. Last order.
Any other discussion? Amendments? Because I'm gonna go to voting to approve as written. Okay, so all in favor is approving as written. And that is unanimous. Okay. And that ends our enforcement actions. Thank you, Board of Health staff, for all of that, and to board members. So let's go ahead and move to, yes, Frank.
I don't know if you want to do it now, but I have general questions about the TUPA and Steri related to effort. I don't know if I could ask now or wait until regular agenda to do.
Let's do this. Let's request that we add that as an agenda item after we do the monthly reports. Okay, so I'll pull that in at the end. Let's keep it going. Okay, monthly reports. Let's go ahead and start with in here. And I have two different versions of who's first. Is it Jenny or is it Dr.? Oh, Dr. K-Bag, yes, go ahead. Go ahead. Thank you.
Welcome. Good afternoon. Yeah. I'm going to start by updating you about the measles because of course that's changed since my report was written in 8/11. So as of today, whole health staff have been involved in 4 separate instances of at least one or more measles confirmed case causing secondary exposures. No Tompkins County residents have been diagnosed with measles to our knowledge. However, each of the 4 instances have involved exposures to Tompkins County residents. Each of the infected individuals reside outside of Tompkins County in an adjacent process of contact tracing and investigation are very similar to that which we did during COVID. The required work is intensive, it's time consuming. Public education and practitioner outreach is likewise. Whole Health has issued alerts to area practitioners and collaborated with regional partners. I'll now summarize the 4 cases and their contacts for you. Since communities of residents for these cases are often small, we only identify individuals by county of residence. All infected individuals were unvaccinated. Contacts may or may not be vaccinated. Please note that the county of residence determines which county health department handles management of the infected individual and of any contacts. The first involves 2 infected individuals of Seneca County. There are 4 other contacts of these 2 people. 2 reside in Seneca County and 2 in Tompkins. The second involves an exposure in the emergency department of a Pennsylvania hospital. There are 7 contacts who reside in Tompkins County. The third is an infected Seneca County person. There are 3 Seneca County contacts. The fourth is a Seneca County resident who became critically ill and was in ICU. There are 24 contacts. 11 contacts reside in Tompkins. Thus, whole health staff are monitoring 20 contacts. The incubation period of measles ranges from 7 to 21 days, so contacts must be monitored for 21 days. The period of contagiousness ranges from 4 days before to 4 days after the onset of a rash. The rash begins 3 to 5 days after initial symptoms begin And those initial symptoms are usually a combination of one or more fever, runny nose, cough, red and runny eyes. So if the first symptoms were to begin 7 days after exposure, the contagiousness of the individual begins 1 day before day 7, day 7 being the first day of the incubation, day 6. Complications are generally coded as the following. 1 in 4 infected persons will be hospitalized. Encephalitis with the risk of brain damage occurs in about 1 per 1,000 infected people. 1 to 2 per 1,000 people die, even with ICU care. And late complications of brain damage occur, although rarely, 7 to 10 years after infection. So the bottom line is that we must presume that we have active measles infection within our county, either passing through, seeking services, or residing there, and unknown to us. Second, being vaccinated against this dangerous disease is the best protection, 97% effective. Even if vaccinated, an exposed person must be monitored for 21 days, since in 3% of vaccinated persons, the vaccine won't prevent infection, though it may reduce severity. Whole Health advises all county residents and those working in our county to know their vaccine status, and if not vaccinated, to become vaccinated now. At this time, Whole Health is not advising vaccinating children under 12 months of age. If this should change, we would make a public announcement. If parents or caregivers have a special concern in this regard, they should contact their child's physician. Pregnant women or those planning pregnancy should contact their physician as they are at special risk. If a Tompkins County resident or a person working in Tompkins County believes they have had a measles exposure, they should contact Whole Health for guidance. If they reside outside of Tompkins County, we will inform the health department in their county of residence. All persons who become ill with a fever associated with a rash should immediately contact their physician and ask if it could be measles. They should not expose any others until receiving advice. They should not walk into a physician's office, healthcare facility, emergency room without phoning and asking for advice in advance. Failure to do this can cause other patients and healthcare staff to be exposed to this dangerous disease. And lastly, N95 masks, when properly applied and used, are protective. So things have changed quite a bit since 2011, and we are not through an incubation period by any means. And I think all counties of New York State need to presume that they may have measles wandering through, at least if not residing within their borders.
Thank you. Questions, comments from board members? Yes.
What number of cases in the community would prompt the immunization below the age of 1 year?
It's not clear. We posed that question to the regional DOH in Syracuse, and they in turn posed that same question to their DOH. And there's no official epidemiological word that we've gotten back. That being said, practitioners have the ability to make judgments based on their patient's particular circumstance. And if they should decide that this 7-month-old child should be vaccinated, they have it within their license to prescribe vaccination. The key difference is, I think, whether we, as a health department, make a blanket recommendation for the population as a whole.
Question. Yeah, okay, go ahead.
I'm just curious about vaccine status because I think a lot of people got this vaccine, say in childhood, and they may think they're vaccinated 10, 20, 30 years later. Is that true?
Yes, it is true. There's some discussion that as you age, immunity and protection, immunity can fade, but there is no change in what is recommended for the protection of an individual, no matter what their age, once they've been vaccinated. So the basic message is if you've received a full course of vaccine, no matter how long ago it was, you are protected. When people have doubt, I'm not sure if I was vaccinated. I think I might have been. I can't find my vaccine records, etc. Generally speaking, a practitioner will vaccinate them because MMR vaccine is so very safe. And it is always given as MMR vaccine because there is no separate vaccine component marketed in the United States. And by giving it as MMR, particularly when we're giving it for the first vaccination for people, it is a very practical way to go about it. We know it works well. All three components, the mumps and the German measles, work well with measles, and it provides effective vaccination. So
What's the turnaround time for getting confirmation on measles steps? Like if someone,
from testing, so it depends where it goes, and the general recommendation of DOH is that it go to Wadsworth, which has the fastest turnaround time and the most sensitive assays rather than commercial labs. Generally speaking, I believe it's true that if it's sort of Tuesday through Friday, or if it's like in the weekday, the turnaround will be within a day, I believe. If we're dealing on the weekend, then we need to interact with Wadsworth to give them a scenario, the clinical picture, and then they'll prioritize appropriately.
is there anything that the schools could do that would help with contact tracing? Like if they suspect there might be a case of measles?
Just as any practitioner, I think, if the school nurse or school personnel yourself, for example, are suspecting measles, then you immediately report it to us. We immediately report it to state. And then usually that truncates what you need to do for contact investigation, because we usually carry the ball there. But there's a lot of advice that needs to be given.
Yeah, like, do we want to know if the candidate was in music yesterday? Like, how many days back do you want us to go to sort of, there's a lot of kids in school who rotate through a lot of things. And sometimes as time moves forward, it's easier to collect information right away versus waiting until there's confirmation of a case.
So you have a child with, let's say, they come in and they don't feel quite well, they got a bit of a temperature. And
Went to a fair, they went to a horse show or something.
you have some reason to suspect contact or something. So, they obviously could be contagious at that point. And so everybody at that point needs to take appropriate steps in ways they can with personal protective equipment. And then you need to go back at least one day, to assess where were they, what were they doing. But a lot of that, we're going to be carrying the ball here with the team here doing contact.
Because we have a set plan. So if someone suspects something, before they do anything, they mask themselves, isolate the kid, mask them if they can, then call us, like the medical team, and then we reach out to you. They check their status on NICIS for immunizations. But I guess it's nice when schools have like a real plan, like collect the data from the day before, where were they, what kids were in class, just so they have all that information. But maybe that's too much, then we wouldn't triggered by the COVID thing.
Information before we ask you for all of that, because it's so much work.
and we really want to know that we have a definite case. But attendance records, I mean, that's it, take attendance.
I want to make a meeting about measles, but I want to add something here too, because we're reading about Tompkins County, but this is really a large outbreak. So because of the size of the health system, we are dealing with local health departments from say to bench, Monk, Tioga, Allegheny, Cayuga, Tompkins, Seneca, and I think there is Bradford County in Pennsylvania. And we met with them Friday, and this is me giving some personal opinion to that this is going to get worse before it gets better because of all of the events that are happening. You had mentioned, because we know that this particular one started with a horse auction in Pennsylvania. There was another event this weekend, another animal auction that we asked the state, like, do you have any super spreader event? Do you have any power to make this stop? It said no. So the event happened. The emergency departments are seeing a lot of cases. We are working on communication because the general population will call in before coming in, but the affected population, because of the nature of communication there, they just walk in, and we put signs everywhere. It happened again today, even though we had like 2 patients that just walked in. You're probably aware, Rachel, you probably got the phone call already. My concern with the schools, the point that you were making, we have a communication plan before back to school, that if you have XYZ symptoms, do not send your kid to school, call first.
I don't know about, the plan that we've had so far is not to like the general public. It's to our nurses and the superintendents that we're working with. And we have a plan that we developed last year, which is basically isolate and call the medical team. And then we can work with, like, don't send them to your PCP, don't send them to the ER. We'll talk you through it, and then we can help navigate that. But we don't work with all the schools.
And are you still a member of the medical staff?
What?
Are you still a member of the medical staff?
Yes.
So Monday, we sent a memo out, because when we had the meeting with the state, they said they're going to refresh the guidance. So you have the newest guidance there. And as Dr. Flickback said, Tompkins County is not going to say we have enough to vaccinate kids below 12, but the state is already making the recommendation, 6 to 12, that you should strongly consider, depending on where they are coming from, et cetera, et cetera.
That is an additional dose, right? So that 6 to 12 does not count.
Yes, and the guidance is very clear there.
So you're saying the New York State DOH has actually determined epidemiologically that they're going to recommend a 6 to 12?
They are walking this very fine line. They don't want to call, they don't even want to call it an outbreak. You're like, we have more than 3, you should call it what it is. But the guidance they sent Friday, they recommend, depending on the local information, that kids should get dose 6 to 12. It doesn't count. So that kid would get 3 that they outlined in the health advisory that they sent. And we shared with everyone, because this is really close.
Did that come to us?
Well, so it's buried in one of the health alerts. It's basically saying measles vaccination in an outbreak area. So are we an outbreak area? So what is an outbreak area? And, it's affecting a certain population. So, like,
Yeah.
does everybody in that county follow that guidance?
And we are
that
not-
outbreak area.
It's not going to get guidance clearer than that at this point. They are really. So Seneca, we talked to Seneca County Health Department. They are calling it an outbreak, and there is active outreach to vaccinate. Yeah, 12 months. We don't have it here, but as Dr. Klipak said, it is a decision, right? If a parent calls and they are concerned, like, my kid is older than that. If they were younger, they were definitely gonna have MMR as soon as they could get.
Yeah.
The county line is not, it's not really a line of infection and non-infection. It's
The part.
Yeah.
it's,
Seneca and Tyco come to our BOCES too.
Right.
We have
They
schools
come.
in both those counties.
and they
that-
come to our hospital. too,
Yeah.
so.
Yeah, this includes children who belong to a community where at least one measles case has occurred or where there are credible reports that measles is circulating. And then it says, yeah, infants 6 to 11 should receive 1 dose.
What I didn't see was antigen in the waste for Tompkins. Do we have that?
So we do have some wastewater reporting. I should check on that. I think samples get submitted like weekly. Twice a week? I don't know.
Yeah.
Different COs.
I can check.
The guidance talk about wastewater in Yates County,
Yep.
but I didn't see other counties.
What do we check for in the wastewater? That's so interesting.
Lots.
Yeah, there's, yeah, I can pull up the dashboard in a minute here, but
Once again, don't want to make it a measles meeting, but this has potential.
yes. Yeah, it's just math. If you have 1,000 cases in the community, 3 people are going to come to the hospital, right? Like, and we know that
There's more.
the affected population, there's a lot out there that's not being.
Ed,
Actually, I'm not gonna ask my question. It was more a technical question with regard to testing, so, but I'm not gonna, I can do that later.
I have been in touch with Cornell Health today.
I know,
About
I
testing.
know you have.
I reached out.
Yes.
All the students.
I'm aware. I'm
okay,
aware. Thank
any
you.
other questions on the medical director report then? We have measles out.
Question. So, Dr. K, so since measles can cause immune amnesia, we lose immune status to other diseases. I don't know how widespread mumps and rubella are within the environment. Would you anticipate we see increases in those 2 diseases as well if people are vaccinated? I don't know if the outbreak here is big enough to see that difference, but
I mean, if they become, would we see increase in mumps and German measles due to measles infection
yeah.
in people? Well, presumably, possibly, yeah.
But I don't know how prevalent the virus is in the community anyway.
Well, I remember that we have heard of at least 1 or 2 mumps cases in New York State, I think, in the last calendar year. German measles now, I can't remember any reports of German measles per se. But
Just curious.
yeah, certainly it's something that a practitioner caring for somebody with measles should be discussing with them as they recover. Do you need to be revaccinated against, those things you were vaccinated for before?
And I think part of this is just the nature of measles being one of the most infectious viruses out there. It's just takes off like wildfire in a susceptible community. Mumps and rubella, I don't think have as high of a like R value in terms of the way that they spread.
Mm-hmm.
No, I recognize that, but I'm just wondering, with the immune amnesia, whether you might start seeing.
Yeah.
And I don't know if that is just in children or adults or both, as far as
The immune amnesia. I've never seen it broken out, distinguishing age groups at all.
curious. Okay, thank you.
Any other questions? Okay, Jenny is not here today, so is there anything that needed to be communicated outside of the report that was already there? Okay, great. Division for Community Health.
Yes, I brought Sue with me today. I'm not sure if you all have met Sue, but she's the nurse manager in our unit. I was actually away for the last 2 weeks, and at the peak of this measles response, Sue was really key to all of this. And so I brought her along just in case there were more questions that I couldn't answer. But Dr. K gave an excellent overview. Our unit's really been swamped between the measles response and also rabies. This is the bats month where all the bats come out and fly through everybody's houses. And therefore,
The tick stuff too, looks like there was.
Yeah. A lot of the ticks we don't really investigate except, the anaplasm and the BCOs. We don't investigate the typical disease, but yeah. So
2 exclamation points, so it caught my attention.
So, yeah, so that's generally been, our work this month has really been, dominated by those two, themes. So if you have any further questions on that, we're happy to take them, but we're really collaborating very well with CMC. I'm really grateful for Dr. Delaney and her team and also collaborating with other counties. I was on the phone with Seneca County yesterday. We had an after hours on-call issue that was related to Seneca County that we passed along to them. So we'll just continue to do our strong partnerships together and to put the messaging out again consistently that vaccination is key.
These both 12 have screens on them.
Both. Oh,
When I was biosafety, I was very good. Numerous calls of bats flying.
oh,
All around and then I had to follow up on them. Because they didn't have screens on the window.
I just came in.
That's just for me.
Well, thank you.
Anything else on community health?
Can I ask an immunization question?
Yeah,
How's it looking for the schools? It seemed like there was a lot more kids this year.
we did get the email from Carrie about how many kids were lagging in vaccination. We have already started to field those kind of calls from parents who are like, well, I just moved to the area. I don't have a pediatrician, but I have private insurance. Like all these sort of like, and my kid's behind on 3 things. And we don't see the kids with private insurance. So then we have to turn around and find them a place at a pediatrician's office who are, I guess, even more backed up than usual. So we're troubleshooting those cases as they come up. So far, they haven't been swamping us. And so far, our clinics still have spots. So if our clinics fill, then we add additional clinics. But so far, so good. I mean, we tend to see that more, I'll say like October even, because the exclusion date, parents wait until like their kids
September 19th.
kicked out of school. And then they're like, okay, now my kid has been kicked out of school. I'll be vaccinating them. So.
That's the wastewater. I'm looking at the wastewater dashboard and it has no measles not detected on there.
Great.
You pull that up, the wastewater dashboard? Like, and can anyone pull up the wastewater dashboard?
We good? And so, could somebody send the Board of Health the link for how to do that at some point?
Sure.
Thank you.
So CDC or New York State?
I looked at the states.
Okay, yeah. Skip and I will collaborate and figure it out.
Okay, great. Anything else? This one? Okay, Sam.
So with the realignment of public health services, there actually will not be any more health promotion, but we'll be updating the packet for, I believe, next month. So my team has moved into an office of communications and engagement. So more to come on that. But I did just want to highlight that until we meet again, there's a lot of events happening over the next month. I mean, including with busy time of year and everything. Some things to highlight: next Wednesday in the evening at GIAC, there's another health fair with Senator Webb's office. And then also our team has been working with Department of Emergency Response and the airport on the Preparedness Expo, which is September 19th. So that's coming up too. And then I just wanted to give a shout out with Skip to environmental health, the water team and communications team, that they did a lot of work over the summer to increase awareness around HABs, harmful algal blooms in the lake. And so they had a little bit of funding from NICHO and were able to do a lot of like creative materials, very visual materials that have been distributed around the county and at different community events. They're also doing a mailing to short-term rental units along the lake, and there was a social media campaign too. So it was a nice way to have sort of a concentrated effort around that issue.
I did have one quick question on your report, which is the event that you went to about the Medicaid changes. could you just, the report wasn't clear what those were. Could you just, at a very high level, just summarize what you think is impactful for the health department?
Yeah, so there's a real county effort across like our department and Department of Social Services, especially, and some other community partners with the Human Services Coalition as well, around different Medicaid changes. So there's already been some SNAP changes that went into effect, but then Medicaid, there's going to be some eligibility changes that are coming, I think, like the end of this month, actually, and then maybe by the end of the calendar year, that are going to require people to be aware of their eligibility status and re-enrolling if necessary. So I don't know that I have like all the details, but yeah, it's and it sounds like there's also just differences between people who are eligible for benefits, like through our DSS, for example, versus some portion that actually have to enroll state system. So it's complicating how people are enrolled and who they know to communicate with, sure their status. So because of all that, there's a need for consistent messaging. So it is more clear.
Okay.
And so that's what there's a like countywide team working on making sure that people are clear about that messaging. And some of the changing requirements like have to do with works. And so there are efforts around that as well, because there are nuances around, for example, like it doesn't even have to be paid work, like it can be volunteer work. So yeah, what it was about, it was sort of high level, and then will be.
Okay, anything else? Another promotion. Okay, Jessica's not here, so I'm gonna assume she's on vacation. I'm not assuming she's on vacation. She is on vacation. And what I'm assuming is that the report will stand for itself, right? Okay, Skip, anything on environmental health?
Couple quick updates. So we did get a bit of good news last week. Governor Hochul announced the awards for the county infrastructure grant program, which is in its second year. So Tompkins County received $1 million. And that's to support the town of Dryden and Hanshaw Village and getting municipal water and sewer to that park. So that's huge. So as soon as we get the official letter, we'll start working with planning, town of Dryden, Hanshaw Village to figure out how this is all going to come to fruition. So certainly really excited about that. I'll try next month to include those documents that Sam talked about for the HAPS communication to share with the board. Sam's team has been great with the development of that stuff. Ted and Shannon and Sam were extremely helpful putting that stuff together. And then I just have a quick rabies shout out to the EH team and to Rachel's team. August is always a busy month for us all. This year has been extra special. I was looking at the numbers. And this is just August and just bets. We've investigated 168 potential exposures, which is an increase of 58% from 2025. We've done 74 submissions for testing, which is an 80% increase from 2025. And our authorization for RPAT, I think we're up to 89 in August, which is a 39% increase from 2025. So it's been a huge effort on our EH staff and certainly on nursing staff that has to do injections, not just once, but 3 times. So kudos to the staff on that. That's all I have.
Great. Frank, I was gonna ask you to raise your questions here.
Couple of questions,
Yeah.
Skip. So, we're seeing a lot of vape shop lines, either new ones or recurring ones. And so are those efforts within the normal inspection frequency, or are you increasing your inspection frequency because we're seeing fines on other vape shops?
Yeah, I would say our inspection, where we're seeing, especially the flavored vape. Yeah, we're getting out there sooner. And you know, we'll probably be bringing something to the board soon. You know, we've been kicking around different ideas on approaches around this. We've gotten further guidance from the state about, you know, revocation. So our understanding before isn't exactly the way the state is interpreting it. So, you know, my hope is before the end of the year to take a look at the board policy and see how we can improve that to maybe streamline some of these bad actors to get it to the point where it's a revocation. We can get to a revocation quicker. So I think it will be good to have a discussion with the board and kick around some ideas. Jenny, I believe someone from Cornell reached out to her about a group who works on policy. So one of the things that we may work with them on is, does a local law make sense? The issue that we had today with who's the owner versus an LLC, certainly a local law will help with that because they'll have to get a permit, certificate, license, whatever we call it from the health department. One of the biggest concerns I have is if we go forward with a local law, is it gonna have the teeth to actually be able to close, like physically close a facility? Because you're right. And we also ran into the issue where we have a place that's operating with no state license. So if we get into a situation where they don't have a permit or a license from us, fines can be effective if they, assuming that they pay. But if they don't pay, what's the next step? That should be closure. So I think those are some of the questions that I want to get answered from a legal perspective. So hopefully we'll take a look and see what's available at our disposal to make more of a dent in. And when I say that, I don't think there's enough shops out there that most of the places are, we have like 60 retailers out there. So I would say it's, maybe 10, 12 that are kind of the bad actors that continue to sell flavored vape. And as far as we know, it's a smaller proportion that's selling to a minor, but how do we really know? So yeah, I don't know.
So I'm going somewhere with my question. So the second question, and we can see from the report today, it's very a tremendous amount of work on your department and the continued inspections. So my big question is, what sort of impact is that having on other normal business, food inspection, wastewater, water treatments? So is that really digging into your other enforcement issues? And is that an issue that the board might want to address if you're being shorthanded on the other areas of work that you're responsible for.
Yeah,
Because you're spending so much time doing vape and especially a lot of time doing stereo.
yeah, so we've tried to contain it amongst a couple of our staff, so it has eaten up a lot of my time, and Adriel Shea has also been a key player, and he supervises, other programs, so, we met the other day, and it's like, oh, we got to get caught up on these issues at mobile home parks. So it does have an impact, but I think we are maintaining okay. My hope is that over the course of the next few months, it's gonna get better. And the amount of work that we have to put into a study isn't as much. But we'll see. But yeah, I may take you up on that offer if it continues at this pace. We also lost our fellow, which, that has had an impact on our water program because she was doing a lot with data monitoring. So we've had to kind of switch gears and put that on someone else. So, we're feeling the impacts, but we're managing it at this point.
And we've had those you've had those ebbs and flows with other big projects, like it's a little bit reminiscent of grassroots too, and a lot of the work that went into that. And this year was, the work paid off and a lot of it.
Yeah. So that's a great example because I feel like the amount of time and I haven't sat down at some point in the near future, I do want to do a evaluation of how much time we've spent on public health nuisances.
Yeah.
Over the last 2 years. But yeah, luckily we've seen grassroots go down. Unfortunately, Asteri's gone up. So we do see that on occasion.
Well, and for me, and Eve, I think you touched on this and related to his first question, but I just wanted to go back to it, is as part of that discussion, what would be helpful for me too is like thinking about the amount of time you're spending on some of this relative to the fines that are being applied, and especially because we have a hearing officer who keeps coming back and recommending lower fines than what we're doing. And that relates a little bit more to the TCBOH violations than Asteri, but or any other, not just Asteri, but any nuisance like that. But I guess I think we need to sort of have a conversation about that as well.
I have some ideas.
Okay, great. I think that was implied in what you were saying, but I just wanted to make sure that, because we did talk about that at the last board meeting as well, that if we need to revisit kind of our stance, or at least have a discussion about whether we want to revisit that stance, I think it's important to do that. And I would rather do it as a broader policy conversation than relative to like a siloed question. I mean, we can apply it to a particular question, but I would rather have the discussion outside of a particular person to start.
Yeah.
A particular organization to start. Okay.
Yeah, we've been in conversation with Holly and so we definitely have some ideas around that.
Okay, anything else in environmental health? Anything else for the good of the group to discuss? Otherwise, I will entertain a motion to adjourn meeting. I have a first from Frank, second from Mara. All in favor? All opposed? Any abstentions? Okay, I think we're unanimous. Okay, thank you. Going Sam. Have a good afternoon.
Yes.
Thank you, Brenda.
Services.